Hi guys. So today I'm going to talk about the complication of PPV. The complication of PPV can be divided grossly into the complication related to cavity creation or a vaginoplasty, the complication related to laparoscopic surgery, and the complication related to long surgeries. As you always say, the average operating time in PPV is 8 to 12 hours. That's 10 hours of average operating time in which 4 surgeons are operating on you. So it's a complex, long surgery, but the final fruit is favorable, so that it's a result-oriented long surgery. By saying this, let me concentrate myself to only the complications of PPV in this particular video. You already have seen the video of me and Hannah discussing about the complication in my consultation video, the link of which is already been shared in the description. Now, let me talk to you regarding the vaginoplasty complication, which could be common to PPV and other vaginoplasty procedures. In a vaginoplasty for M2F, the cavity creation, that's the most important aspect, and that is to be done in an adult android pelvis, which is shallow, narrow, and long, and that space is not there. So, slowly, steadily, the cavity has to be made, in which the risk of injury to the rectum or anal canal posteriorly, urethra, prostate, bladder anteriorly is always there. The risk of injuring the vital structures like blood vessels, nerves are always there. The risk of injuring the neurovascular pedicle of glans penis, which carries the orgasmic sensation in future, is always there. The risk of excessive bleeding is always there. But as you choose your team wisely, and as you choose your team who has enough experience in this anatomy, such kind of complications can be drastically minimized. To minimize this complication, the pre-operative workup is equally important, in which the patient having some of the addictions, some of the comorbidities are to be explained, that they are on a higher risk of such complications. By saying this, the laparoscopic complications will be taken in detail by Dr. Latika Chawla. She is a laparoscopic surgeon and she handles the PPV cases in this particular team. Let me just touch the gross complications, or let me just touch superficially the complications of laparoscopic side. That's basically the injuring the vital organs and tough dissection between the peritoneum and the bladder. But in detail, Dr. Latika will take you through this topic. The complication of long surgery, now that could be any surgery. The general anesthesia related complications are always there. The lung health should be monitored before the surgery. The DVT prophylaxis, there's a deep vein thrombosis prophylaxis to be taken to avoid the complications of deep vein thrombosis and pulmonary embolism, which is one of the life-threatening complications. Along with that, the positional of the limb, the nerve pressure, the neuropraxias are to be avoided. For that, a lot of amount of cushioning to be done, a lot of amount of new instruments have come into the market, and the cushioning devices have come to the market to avoid those kind of problems. After long general anesthesia of 10 to 12 hours, the lung health should be improved by keeping them into the ICU, and if there is a peri or a pre-operative lung problems, that we have to take care into the account before doing the PPV. Again, this in detail will be taken by Dr. Renu Ranka. She is the anesthesiologist of this team, and she will kind of walk you through the complication related to the general anesthesia. This video was mainly to highlight the major complications of PPV. PPV is a long surgery. The ideal classical PPV is going to take 10 to 12 hours. The proper flap elevation is going to take time. But if done properly, there is very less complication and a better vagina in future. To watch the complication of laparoscopic surgery, watch this video by Dr. Latika Chawla. To understand the complication of long general anesthesia, watch this video by Dr. Renu Ramka. Thank you.